Today we're going to talk about the ALS algorithm. Before we start, if you're the first on the scene, you do your BLS, so check for danger, and then check for responsiveness, hard taps on the patient, and try to get a response. If you don't get a response, send for help, and if you're in a hospital, call a code blue. Then you open the airway with your head tilt and chin lift and look for anything obstructing the airway. You also at the same time listen for breathing and look for chest rise, and if there's none, then you start CPR. So you're coming to the scene of the code blue, and CPR is ongoing at 30 compressions and 2 breaths. A defibrillator is attached as soon as possible, and then you need to check a rhythm. So we used a coached approach. So you continue compressions, you say oxygen away, then all others away, start the charge. If it's a biphasic, you can start at 200 for the first shock and then 360 for the second and subsequent shocks. Then you say hands off, and the person doing the compressions will say I'm safe. And then you evaluate the rhythm to see if it's shockable or non-shockable, and then you defibrillate or disarm depending on that. So looking at the assessing the rhythm, so those that are shockable are VF and pulseless VT, and the rest are non-shockable. So in terms of the drugs that you give, so it's adrenaline 1 milligram, so you can make it 1 in 10,000 by putting 1 milligram, and then adding 1 mil of the 1 milligram, and then adding 9 mils of the normal saline. And then after that, so if it's a shockable rhythm, you only give the 1 milligram after the second shock, and then every second loop. And then however, if it is non-shockable to begin with, then you give the 1 milligram immediately. Amiodarone is given after the third shock, and that's 300 milligrams. You can put 300 milligrams in and draw it up to 20 mils in 5% dextrose and give. While you're having the CPR, make sure that there's adequate IV access, and you take bloods for a gas to look for other causes. And you consider the 4H's and 4T's, so hypoxia, hypovolemia, hypokalemia, and other metabolic disorders, hypothermia and hyperthermia, attention pneumothorax, tamponade, toxins, and then thrombosis.